So firstly, for those who don't know me, I'm Imrana. I'm a GP at Wood Grain Surgery and GP Clinical Lead for Mental Health and LD for Newham in Well CCGs. I just wanted to start by saying thank you, really. Thank you for NHC for having a section on wellbeing in the key update seminar. So I think because we all perhaps need to change our mindset into thinking that wellbeing is a key clinical priority. So next slide, please. Yeah, and not just as an added extra. So if I have time, I'll do something for myself. So all these updates we've heard about today, like the home monitoring service, the hot hub, all the services that are being rolled out, are excellent, are great, but won't be effective unless the workforce are physically and mentally strong and fit. What I would like to do is just very briefly talk through a few concepts, tips and resources that I find useful, and I hope that you will find useful too. So next slide, please. So I've just developed this diagram, or if we can go to that, which I call the layers of defense for well-being. It's the me, us and them concept, and it's used in various settings, but I find it a useful framework to think about well-being in this framework. So me is about myself, about your housekeeping. What can I do for myself to keep myself physically and mentally fit and strong? The us section is about what we can do together. So within your practice, within your PCNs, within your organization, what you can do to help each other. And the them section is really about the wider system, the organization, the things that affect the workplace environment that we work in. So what I would like to do is just go through each of those in a very little bit of detail, and then just give you a few tips and resources regarding them. So the first one is really a really key question is, what can I do for me? So we're all used to giving and doing things for other people, but this is a really key question, is what I can do for myself. And what I would like to do is set everyone a challenge. So my challenge to every single person on this call and others is to disconnect to connect. So next slide, please. This is my challenge to you all, and what I would like everyone to do as a challenge is, it's going to be difficult to do, but for this weekend, it's a weekend challenge for half a day. What I would like is for everyone to try and disconnect off their screens for half a day. I know that sounds quite ambitious, but I think it's really important to try that. So what I would like people to do is to disconnect from our devices, and this is something for everyone, but a special request for our leaders and those who are in leadership positions, because we know that if you're in a leadership position, when you turn off your EMIS, you can't switch off your mind. And I know we've been doing amazing things on the leadership WhatsApp group, the GP WhatsApp groups, emails, have all been really useful. But I think we all need to realize that if we switch off for half a day, things won't fall apart, and actually things can get better. So what I would like people to do, if they can at this moment, be brave enough to either physically raise their hand or with the icon that you're going to try this weekend. So I've not done this before. It's scary for me as well, but especially since the COVID has started, we've been, on our devices, updating all the time. So I don't know if I can see if there's anyone who's, a few people have agreed. So fantastic. Thank you so much for that. So Lena, next slide, please. So this disconnect to connect challenge, as I said, it's about connection, and I'm not going to tell anybody who to connect to and how to do it. That's a very personal thing, and it's about what brings peace to you, what brings pleasure to you, what gives you refreshment, relaxation, joy. And I've just made this diagram because I find it helpful to kind of as a framework. So as we've heard very sadly that a couple of our colleagues, GP colleagues, are in ITU, and one of them, as you know, is very dear to me. So for me personally, I really need my connection with God, so to give myself strength at this time. So whatever works for you, connecting with God, to prayers, connecting to yourself, go for a jog, meditate, read, and connect with others, those around you, your family, your friends, pets if you have. And clearly, I mean those who are within your household, you can physically connect with, and those who are not within your household, that's a virtual connection. And so the next part of that defense circle that I showed you is the us. So what can we do for each other? And again, what I would like to do is plea to us all that we reach out, we ask, we listen, and we connect. And if we do that to those who we wouldn't naturally reach out to, and we all know who's in our practices, we don't need to list them, but just a request from all of you to perhaps take that step to reach out to our trainees. Our trainees, I know, are having a hard time. They've had their exams cancelled. They were getting their head around working in primary care, and now everything's turned on its head. They're expected to do more shifts. Their educational supervision has gone. We really would like people to kind of reach out to their trainees, and I know the trainees within our practice have been very, very appreciative of this. Now, so think about the way to do this. Again, I'm not going to be prescriptive. You can do this in a formal, structured way, or just have an informal chat with people, or you can do a combination of both. And just as we know, this challenge, we're all going through it together, but it's impacting people in different ways. As well as our workplace, we've got so many other things happening in our life. Some people have family members who are unwell. People have health issues, financial issues. So that's my little plea to everyone to help each other out. Next slide. So again, I like to think of Newham as a family. So I put this as part of us and not them. And these are a few excellent things that are already happening, and some of them are soon to happen within Newham, and mainly run by the training hub. So one is mindfulness, breathing, relaxation sessions. They're led by Dr. Showman. They happen every Thursday. I think we've had 2, possibly 3 already. He's a local GP and a meditation teacher, and really good feedback regarding this. I'm happy to announce that we're having a reflection space, which we're starting this week on Wednesday, and this is again something really exciting. We've got Dr. Apostolou, who's a consultant psychiatrist, and she's got real experience in primary care because she used to work as a primary care liaison consultant within Newham. So she's got really good understanding about primary care and the stress that we're under, and also she works currently as a consultant in medical psychology. So that's something I'm really excited about. We also have really useful peer support groups which run every other week, and they're facilitated by experienced GPs, appraisers and educators, so Kavita and Co. And the details of that are on the Newham Trading Bulletin, which I think the first one came out this week, but it's planned that it will be rolled out weekly. And then just lastly, I've got a little plug about my own thing. So most of you know I'm doing a survey on exploring the COVID-related anxiety and what support can be offered. So what I would like to do is so thank you for everyone who has completed it, and for those who haven't, what I would like to do, let's see if my technology works. I am going to
I've already pasted it in the chat group.
Yeah, I've just pasted it onto the chat group, if you can see. And what I would like is if it literally is a 60-second survey. So those who haven't done it, I'd be really grateful if you could just click on that and literally take 60 seconds to fill that in. And for those who've done it, and I know many of you have, so thank you so much for that, is just to take 60 seconds to think about how you're going to disconnect to connect this weekend. So, and it's going to be harder. That 60 seconds starts now.
Oh, we're doing it live? Okay.
Yeah, please.
Yeah.
Take 60 seconds. It really is a 60-second survey, so those will clearly be able to complete it before the 60 seconds up. And for those of us, I know this 60 seconds is stretching, so really think about how we're going to do our disconnect to connect challenge over the weekend. this may be the only chance we have to think about it. Okay, so we're wrapping up. So yeah, perfect. So thank you for everyone for doing that and taking that 1 minute out. And so my last few things I just wanted to mention. So within Newham, the other thing which we have been able to establish is some mental health support for those PCNs who are in the mental health transformation. We've got 2 fantastic ABT nurses who are now working within the PCNs, and they're offering support, listening and signposting, and it's kind of between 9 and 5, and it's available to all staff within those 2 PCNs, so South 1 and Newham North. And what you do is you email the nurses with your details, and they'll call you back. So I've just got 2 more quick slides a few more quick slides to go through, and then I just wanted to touch about the them aspect of it. So there's lots and lots of resources around. It can be quite overwhelming, so I've just put 3 really key contacts and links onto the slides. One is Practitioner Health Program, so that's a service for doctors and dentists. They provide consultations, but as well as that, they've got some really good resources on their website, which I've put up there. The next one, again, is something very new. It's run by the NHS, and it's called the People Wellbeing Support. Again, lots of really good online resources on there. And the other key thing they do is they offer a helpline. So this is anyone who works within the NHS, or all our staff, our receptionists can access this. And this is a call-in line, support line, and it runs 7 to 11, 7 days a week. And there's a text message option for that as well. And then just lastly, a lot of people ask me about apps, and trust me, there are lots and lots of apps available. So I just wanted to put in my top 3. And these are all free for NHS staff till at least December of this year. So Headspace, Unmind, Sleepio, and then the links are up on there. So really just wanted to summarize with my last slide that when we're thinking about well-being, it's those kind of think about those layers and what we can do within each of those spaces to make ourselves and the people we work with better. So things for yourselves, something you can do for others, and then what resources are out there for us to reach out to if we need. And that's really all from me. I just wanted to say, again, thank you for having me. And I've got my email address on there. And what I would be very, very keen for people to do is those who agree to do the Disconnect to Connect challenge is to let me know how it goes. Most of you have my mobile number, so WhatsApp me, message me privately on the group if you feel comfortable, or you can email me. And I'd really, really be interested in how that goes for everyone. Well, thank you, everyone. Take care. Stay safe.
Imrana, excellent. Thank you very much. It will be a huge relief for many of us, really. I must tell. I can see that text messages coming all around. They're all thinking on half-day rest tomorrow, at least from the WhatsApp at least, I believe. But it's really helpful as well. And your personal contact, supporting individually, is really needed in this really anxiety time. I must have individually myself as well.